On today's video, let's cover the most ignored reason why your antidepressant is not working. And we've made multiple videos on antidepressant medications and how they've been woefully under effective over the years. And we've made the point that part of the reason they're so ineffective is that they're based on a hypothesis of why people are depressed that's never been proven and has actually been proven to not be the reason why people are depressed. But the pharmacology and big pharma machinery are in place. So, they're going to stay there until we grassroots change the system. But I'm going to show you research today that shows you why a major reason why the antidepressants don't work. And if you can't tell by the image, it probably has something to do with your gut, right? And the gut-brain axis. And if you haven't heard of the gut-brain axis, then I would recommend you read my Amazon best-selling book, The Autoimmune Answer. And chapter 5 is all about the gut-brain axis. And essentially what it is you can't separate what's going on in your head from what's going on in your gut. And oftentimes what are considered neurologic or psychiatric issues or emotional issues, such as anxiety or depression or migraine or dizziness or brain fog, oftentimes those are actually being caused by something that's going on in the gut. But if your neurologist or your psychiatrist never consider your gut health, you may not get the solution or the help you need because you're not addressing the cause. And there's a brain gut end to that axis as well. It's a loop. So just because you have GI symptoms doesn't mean it's a GI primary. It could be, residual from a head injury or from all kinds of stress or mental emotional thing you're going through. And IBS is a classic example of a brain gut issue. So the book, chapter 5, talks all about that. Or if you prefer to watch, I have a gut-brain axis playlist on my YouTube channel with 13 videos on it, soon to be 14, because this one will go on there too, where I address all kinds of angles of the brain-gut loop. And so today, what we want to focus in on is recent research from the journal Neurobiology of Disease, or the Journal of Neuroinflammation, and the paper is entitled Inflammation-Induced Histamine Impairs the Capacity of Escitalopram, which is also known as Lexapro. So inflammation-induced histamine impairs the capacity of Lexapro to increase brain serotonin. And if you know anything about Lexapro or other selective serotonin reuptake inhibiting medications, or SSRIs, such as Prozac, or Zoloft, those kinds of medications, they aim to help a person with their depression by selectively preventing reuptake of serotonin in the brain. And I'll draw this for you in a little bit. But if you inhibit their ability to do that, you stay depressed. And so this paper is very important because it helps us understand why a large amount of people on these medications are failed by the medications. So let's dive into the study. So here we are, and forgive me, I misspoke earlier. It's the Journal of Neuroscience. You can see here from 2021. And again, the title is Inflammation-Induced Histamine Impairs the Capacity of Escitalopram, or Lexapro, to increase hippocampal extracellular serotonin. And the hippocampus is the part of the brain where low serotonin promotes depression. And so that's what hippocampal is. So if we look at the abstract of this study, it's you can see all the colors I use because there's so much in here. This is a huge study to help us explain and understand depression and why SSRIs may not be helping. And it also helps us understand the gut-brain axis, as you'll see. And it's a very frustrating study too, because the researchers are super myopic in how they interpret it, and we'll talk about that in a moment as well. But I'm going to read to you a little bit, and then we'll go to the whiteboard and draw it out and help you explain it or understand it further. So starting at the top, commonly prescribed selective serotonin reuptake inhibitors, or SSRIs, antidepressant medications. These medications inhibit the serotonin transporter to correct a presumed deficit. I have that in red because it's never been proven. It's a hypothesis, and there's been many papers saying that it's an incorrect hypothesis. So we're taking medications to address a guess that hasn't been proven correct, and that guess is that depression is due to a deficit in serotonin signaling during depression. So not enough serotonin outside the neurons in the brain. So these drugs bring clinical relief to many who take them. However, a significant and growing number of individuals are resistant to SSRIs or are not helped. There is emerging evidence that inflammation plays a significant role in the clinical variability of SSRIs. So in other words, there's emerging research showing that inflammation helps explain why one patient might do okay with them and why another patient might not be helped at all. In this work, we investigate the nexus between serotonin, inflammation, and these medications. Upon acute systemic lipopolysaccharide administration, and this is a mouse study, so they inject lipopolysaccharide in mice, and we'll talk about what that is in a moment. We find robust decreases in extracellular serotonin in the mouse brain. We show that these decreased serotonin levels are supported by increased histamine activity because of the inflammation. So the inflammation increases the histamine, decreases the serotonin by acting on inhibitory histamine H3 heteroreceptors on serotonin nerves, or serotonin terminals, excuse me. Importantly, in blue, under lipopolysaccharide-induced histamine increase, the ability of Lexapro or escitalopram to augment extracellular serotonin is impaired because of an off-target action of the drug to inhibit histamine reuptake. Finally, we show that a functional decrease in histamine synthesis boosts the ability of the drug to increase extracellular serotonin levels following LPS. We're going to go through all this. This work reveals a profound effect of inflammation on brain chemistry. Boom. So why don't we figure out why the brain is inflamed rather than just put a drug over the depression, right? This work reveals a profound effect of inflammation on brain chemistry, specifically the rapidity of inflammation-induced decrease in serotonin, and points the spotlight at a potentially critical player in the pathology of depression, that being histamine. And again, if you're pointing a spotlight away from the cause, if you're not shining the light on the cause, then you're never going to address the cause. And here's another great study where the cause is right in front of their face and they're looking at something else. So they're not going to help the patients as thoroughly as they could. And part of the reason why is because if they were going to help them as thoroughly as they could, or as thoroughly as functional medicine would, then they wouldn't be on medications and they wouldn't be in the system. So they're not incentivized to actually address the cause. But as you'll see in a moment, it's right in front of their face. And you can see up here that this study was done in the Carolinas. So it's a bunch of researchers from University of South Carolina, from Duke, from Ohio State University. So these are smart people, but I guess blinded by the paradigm. So let's dive in here a little bit further, and then we'll draw it out for you. So one thing that they mention here is that these antidepressant medications have lost popularity in the research community. And recent work has targeted other means to treat depression, including ketamine, psychedelics, electroconvulsive therapy, vagus nerve stimulation, and deep brain stimulation. Well, they've lost popularity because they're not working, all right? The comorbidity between inflammation and depression is now well accepted. So again, we talked earlier about so these antidepressant medications are given based on a false guess about how depression works, and that guess is that people are depressed because they have low serotonin as the primary cause. Well, that's never been proven, and it's not true. And every day, more research piles up to say inflammation is the driver of depression and is the driver of anxiety and other psychiatric symptoms. So neuroinflammation or brain on fire is the driver. And if your brain's on fire long enough, you may end up with low serotonin. Or as this study shows you, it doesn't have to be on fire long at all for you to be deficient in serotonin. But if you only address the serotonin, you haven't addressed the cause, because the cause was whatever's driving the inflammation. Okay, so here we go. We found rapid and robust decreases in hippocampal serotonin in response to intraperitoneal LPS injection. Okay, what the heck is that? Intraperitoneal, the peritoneum is your gut, or is your abdomen. Okay, it's where all your gut organs are. So what these researchers did was they took mice and they injected mice in their guts with lipopolysaccharide. What is lipopolysaccharide? Good question. Lipopolysaccharide is one of the most pro-inflammatory things we know in science. So why did the researchers use that? Because they wanted an inflamed mouse, so they could study that, right? And they know LPS is going to do that. Well, then where does LPS come from? In real life, LPS is produced, and how are humans and mice and all of us exposed to it? LPS is produced by gram-negative bacteria. Gram-negative bacteria produce this in their cell walls, and they're dumping this off in our system, and LPS sets us on fire. An example would be Helicobacter pylori, or Klebsiella pneumoniae, or Citrobacter frundii. There's a bunch of different gram-negative. E. coli is another one. So there's a bunch of different gram-negative bacteria that produce this, that are very common in us, on us, in our environment. And so again, that's important because we all have guts. We all have gut microbiomes, and it's not uncommon for us to have overgrowth or infection with gram-negative bacteria that will produce lipopolysaccharide. So if LPS levels in the gut, as the study is showing, are driving brain inflammation very quickly, we found rapid and robust decreases in brain serotonin in response to injection of LPS in the gut. Okay, how many people are walking around with gut issues and with depression, and they're only looking at the head and the depression symptom? Tons. Okay, if you read my book, I talk about it. There's been studies that suggest 2/3 of people with anxiety or depression started first with gut issues, but they're only being treated for the anxiety or depression. No wonder they don't get better, right? And this study is showing us why. So the gut inflammation started first, then the serotonin deficiency and the depression. We found that the ability of the Lexapro or escitalopram to increase serotonin levels was blunted in the LPS injected animals, an effect that we found to be SERT independent, or independent of serotonin receptor levels. The decreased serotonin in the inflammatory state was supported by increased brain histamine. We show that the reduced ability of the medication to increase serotonin after the LPS likely lies in its capacity for also inhibiting histamine reuptake. So this is interesting, because what happens is the medication is a serotonin reuptake inhibitor, and I'll draw that for you. But what that does is it's inhibiting the clearance of serotonin from the brain. So it's making the serotonin stick around in the brain longer, so you theoretically get the antidepressant effect longer. But what this highlighted part of the paragraph says is that escitalopram or Lexapro, although it does slow the reuptake of serotonin, it also slows the histamine reuptake, which is a double whammy in this situation, because the histamine is driving the serotonin deficit, and the histamine is driven by the gut inflammation. So the gut inflammation drove the histamine, which is driving the serotonin deficiency, and the drug can't work because it's also slowing the histamine reuptake, or leaving the histamine in the brain longer. Boom. So what do the authors say? And this is what kills me, and this is why people don't get better. I crossed it out because it's so off base. Quote, "Our work implies on a fundamental chemical level that it is not yet time to give up on SSRI therapy, particularly in the context of elevated inflammation. but rather to consider this treatment in tandem with agents that block the ability of histamine to diminish serotonin release. So they're so close to actually getting the answer, but they're so blinded by pharmacology and the one drug, one cure paradigm that they totally miss it. So instead of saying, hey, why don't we just look for gut inflammation and address the cause of that, so we need no medications, they say, well, because this medication doesn't work, let's add another medication to cover the side effect of this medication. Essentially, this medication isn't working because it's keeping the histamine in the brain longer. So we need to give this medication in tandem with a histamine clearance medication. It's like, oh my gosh. This is called polypharmacy, and drugs for the side effects of drugs lead to poor life and earlier death. And none of them are addressing the cause. So what they should say is, how did the depression happen in the mice? What was the first thing that happened? We injected them with LPS in their guts. Interesting. Well, if we're causing inflammation in the gut and that leads to high histamine in the brain, which leads to low serotonin depression, rather than play with brain chemistry, why don't we just get rid of the LPS? And in the case of humans, that would be balance the gut microbiome, get rid of the gram negatives that are spewing out the LPS. And again, why don't they do that? Because you can do that without medications, and then you're not on a drug forever and you're out of the system. So this is just an epic study that is a fail in terms of medicine missing the boat on what they should really be reporting about it, but we can take it and help people and get results that they can't. So I think that's all I'll show you for now from this study, other than this blue line right here too, where they said a low LPS dose significantly decreases serotonin levels too. So that's important, because the LPS you don't have to be septic. Okay, you don't have to have this massive infection with tons of LPS where you go into the hospital to be dealt with. It could be a low dose, like a dysbiosis level dose, instead of a septic infection dose. So that's important, because most people are not septic. Most people are walking around with dysbiosis and a functional gastrointestinal disorder, one that their gastroenterologist is saying, you're fine, no problem. And they're like, well, then why am I still depressed and anxious, right? So it doesn't have to be a massive septic dose. So we will leave it at that, and let's go to the whiteboard to draw this out for you. And what I want to do first is draw out the neurons and the chemistry for what the medications are doing, because I promised you I would a couple times. So we have one neuron here. Okay. And then we have another neuron coming to talk to that one right here. So we've got, the message is transmitting this way. And this area between them is called the synapse, or AKA the synaptic cleft. And the way that neurons communicate is you get down here and there's little packets of serotonin in here and in histamine. Okay, and when the message gets here, the neuron knows what to release, and it releases serotonin out here. So now you have serotonin, and it releases histamine, and it might release dopamine or acetylcholine or other neurotransmitters, depending on what the message is and what's going on. So then that serotonin comes over and connects to a receptor right there, and the histamine will come over here and dock on a different receptor, and then their binding to this neuron determines the message that's sent down and to the next one. And this goes on and on across your brain. We're talking to the next nerve. Okay, so the way that, let me get a different color here. So the way that an SSRI medication, so if we use an SSRI, selective serotonin reuptake inhibiting medication, which in this study they used escitalopram, which is also known as Lexapro. Okay. And that medication, their goal, so what they say is that depression happens because we don't get enough serotonin in here. So if you don't get enough serotonin, the message isn't propagated and you have less brain function. Okay. But that's been proven to be not the cause of the depression, but an effect of the cause, which is the brain on fire. Okay. So their goal is to use a medication here to come and after the serotonin here binds this receptor, there's what's called reuptake, and it's taken and it's shipped back here to be used again for the next signal. Okay. Well, what the drug does is the drug is a selective serotonin reuptake inhibitor. So what it does is it'll keep the serotonin in this cleft longer, so preventing it from being reuptaken or shipped back here, right? So the longer the serotonin can stay in the cleft, the more receptors it can ping, 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 and then you get more serotonin messages and less depression. All right. But what the study showed was that when we have a gut, okay, and if we inject that gut with inflammation, so they're going to stick a needle in there and they're going to inject it with LPS, which remember is one of the most pro-inflammatory things we know in science. That LPS leads to a brain on fire very rapidly. Okay. And the fire is started because you have an increase in histamine in the brain, which leads to a decrease in serotonin. And then that decrease in serotonin leads to depression in their model. So they're looking to increase the serotonin, which isn't really increasing it, but leaving it in the cleft longer, so relatively it's increased. All right. And we talked about that needles aren't where LPS comes from in real life. In humans, it comes from gram-negative bacteria in our guts. And these gram-negative bacteria secrete LPS. And that LPS hops in the bloodstream and can travel up to the brain and drive that brain inflammation. So rather than focus in on this teeny tiny little space here to address the depression, why don't we come to the gut here and get rid of the LPS producing bugs and give you back probiotics and clean up your diet so that you're not feeding pathogens and promote barrier integrity in the gut. So avoid things that destroy the gut barrier, such as antibiotics and alcohol and glyphosate sprayed on every farm in the country and high stress and endocrine disrupting chemicals like BPA in our plastics and hidden estrogens in our makeups, potions, lotions, and all that stuff. So if we want to prevent LPS from hopping in the bloodstream and getting into the brain, we can prevent colonization of LPS producers, and we can do that by promoting gut barrier integrity by cleaning up all these areas and more. Okay, so I hope this makes sense, and I hope you see that, you know, that study is epic because it's actually showing us that we're on the right track in promoting gut health in cases of psychiatric disorders like anxiety and depression and, you know, psychiatric symptoms like brain fog and migraine and other things. So look to the gut in this case based on this study rather than looking to zero in on the neurocleft, which is an effect of what's happening on a macro scale on the gut brain axis. So let's open this up for questions.
The best way to test what you're talking about, is that through the, when the blood tests that you test histamine, or is it the stool test?
Well, it depends on what you're looking at. So if you want to know your histamine level directly, you have to test the histamine level. So testing it in the blood would be how you get that best answer.
Okay,
but if you're wanting to understand, do you have a bunch of LPS producing bugs that may be producing high histamine because of the LPS, and that histamine is driving depression, then the stool test shows you the bug side of it. Ideally, obviously, if we're thinking this mechanism is involved, we want to look at the stool to understand the bug part. We want to look at the histamine to understand, are the bugs in the stool resulting in high blood levels of histamine? And then, if there's depression, then having those two tests positive would help us understand that's likely a significant contributor to your depression.